Go.
Hi everyone, hi Bridget, I'm Kelly and I'm going to be performing catheter care. And so the first thing, like we always do when we come in, we assess the room, we assess the environment. This is not a real person, this is just, yeah. So we're gonna ask for the name, date of birth, and we're gonna explain and be like, hello, I'm gonna be changing your catheter today. Is there any pain, not changing catheter, inserting a catheter. A lot of things going on this week. Inserting catheter, is there any concerns you have at this time? She's gonna say yes or no. We're gonna remember if she does. We're gonna chart that. Okay, so the first thing I do after that, I'm gonna perform normal hand hygiene, foam in, foam out, and I'm going to put my gloves on. That's gonna be closed obviously because that's sterile and I'm reusing my equipment, so it's fine. My gloves, yes. And so we're gonna have the sheet on the bed, and we're gonna perform as much privacy as possible. So we're gonna make that diamond shape where it goes up and over and up and over, but we don't have a sheet for her today, so we're gonna pretend this is our diamond sheet, okay? So I have all my supplies ready and everything. I have my towel, so we're gonna pretend this is a washcloth, and we wanna remember that when we clean, each side gets a different part of the washcloth. Or if you don't feel comfortable with that, just have a bunch of different washcloths. But for filming purposes, we are going to use this one. So my first, it's gonna be warm, it's gonna be room temperature, comfortable, and if the patient says it's cold or too warm, we're gonna go get a new one. Okay, so the first step we're gonna do is we're gonna clean, and we're gonna go away from me first. So I'm gonna go down, okay? And then I'm gonna get a new part of the washcloth, and then I'm gonna go towards me, and then new part of the washcloth, and then I'm gonna clean Olivia, okay? And then I'm just gonna pretend I'm gonna put that somewhere. I'm gonna take off my gloves, and there's gonna be a biohazard bag here as always for things that are contaminated. And so I'm just gonna pretend to set these over here. I'm gonna wash my hands. There's like powder and stuff on these, not cool. Wash my hands. Okay, so the first thing I'm gonna do is I am going to open up, and like I said, reuse the supplies. So this was already open. In a normal situation, this would have been closed. And the first thing I'm going to take out is my drape, which is gonna go under my patient. And as always, the corners are the ones that are the most contaminated. So the shiny side goes up, it goes down, shiny side goes down. They're different for every care that you're presenting. So some has colors on them, and if the patient can't help me, I am always gonna ask for someone to come and help me lift, because we wanna make sure that they're safe and whatever. But for this purposes, I just slid it under with the corners, okay? So the next thing I'm going to do is I'm going to put on my gloves. So I'm going to reach in here, and the inside of the gloves are always the part that is not sterile. And I will fix those when I get my other ones on. So reaching in the inside of the glove, I'm going to put
The cuff.